Good day, especially to our beloved clinical instructor, Mrs. Judiliza Velayo. Good day, ma'am. Please allow me to introduce myself. I'm Mae Silvestre, Mae SC Joshua. So this video will be told the head-to-toe assessment of the newborn. So without further ado, let's begin.
I'm Sarah Silvestre, a student nurse for today. So, I will assess you from head to toe. I think it's that okay, no? No? Thank you. And, of course, I will check your ID, your identification band for your names, which is James King. So handsome name. And you were born on October 15, 2020. So now, baby, I will assist you for head to toe. Okay? So now we have the initial assessment of the baby. So first, we have the identification. We already done, and the identification, which is we already know the name and of course the birthday. So right after, we have the vital signs. In vital signs, we have the heart rate, respiratory rate, as well as the temperature. So we now assess the heart rate of the baby. We will assess it in just 1 full minute, and then we will use and select the part of the stethoscope, which is the bell, and listen for the heart rate in 1 full minute. So this is the part of the heart. This is the part of your bell, and we will put it in the heart of the baby, and just 1 full minute. The normal heart rate is between 120 to 140 beats per minute. So right after, we have the respiratory rate of the baby. So in this respiratory rate, we will assess the rising and falling of the chest of the baby. So here, this is the chest. Then right after, the normal respiratory rate is 40 to 60 breaths per minute. One more thing, it is better while listening to the lung sounds, further listen as well as to the respiratory rate of the baby. So the last one is the temperature. The temperature using the thermometer. Be mindful, we need to clean it first before putting on the baby. The part that we will need to put it is in the axillary part. We slightly up the upper arm of the baby and just put it. And then right after, we have the listen, that toot 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 thing, and that's fine. So the normal Celsius of the baby is 36.5 to 37.5 degree Celsius. Assessment is a physical assessment. We will illustrate the technique for obtaining the accurate measurement from the head circumference, chest circumference, the length, and the weight. So first we have the head circumference. It is measured with the use of temperature that drawn across the center of the forehead and the most prominent portion of the posterior head of the baby. So using this tape measure, we will put it in the head of the baby. Slide up and be careful while you are going to measure the head circumference of the baby. And then right after, you will take it further. So he has 37, and that's normal. And the normal is measure of head circumference is 33 to 35 centimeter. Right after is the chest circumference. In chest circumference, it is measured at the level of nipple, and it's about 2 centimeter less than head circumference. So let's measure it. Be careful while taking it. Don't cry. Ooh, there's... Oh my god. So, we are going to 39 or 40. And that's okay, and that's great. So the normal is 30 to 33 centimeter. And the length that's grown to the heel, this, which is in the foot or the bow of the foot, it should be supine position. It's already did. And the baby is already in the supine position, apparently with the upside down, and the knees is slightly pressed down to obtain the maximum length extension. So hanggang dito. Okay? So we will try it from the head of the baby, just this one. Okay? And slightly pull down this. Okay. Wait. That's right. It's 49 centimeters. And that's great of the baby because the normal is 47 to 50 centimeter of the length. So now we have the weight. We will ask the mother for the weight of the baby, no? And then the average birth weight is 2.5 to 3.5 kilogram. So, mom, do you know the weight or the kilogram of your baby?
2.8.
Oh, 2.8. That's great. So now we will move on to the head to toe assessment. So the first is the posture and the movement. We're going to set the position of the baby and the supine position, which is already done, with the partial flexion of the arms, the legs, as well as the hands, and turn the baby a little to one side. The hip and joint are partially abducted. This one is like usually this is normal. So the movement is usually seen, and that's evident, as well as the pace and the limb. And that's normal. Everything is normal. the second assessment is the skin. So the color of skin that reflects the circulation, oxygenation, and hemoglobin saturation of the baby. Color is the best observed in well-lit room while the newborn or the baby is quiet and has skin color. It's normal. It's pinkish and that's normal in the baby. And now the entire body of the baby, as well as the skin folds, as well as the scalp, it should be inspected and palpated for changes in textures and the presence of masses that are not visible. So we have the skin condition that we need to inspect. Like for the example, the lesion, the birthmarks, the milia, the burnix, the lanugo, as well as the rashes. So you will see, or you need to inspect if it has the jaundice, or as well as the Mongolian spots of the baby and the skin. That's you need to see. And if it's for example, if it's the jaundice, which is the bright red yellow or an orange, so it is discoloration usually in the skin, but the baby has no jaundice, so that's great. And as well as the Mongolian spots. In terms of Mongolian spots, so let's see if he has Mongolian spots here. Baby, do you have a Mongolian spots? Yes, he has a Mongolian spots in her pelvic area. And then this is a glue grain resembling a bruise that are most often seen over the sacrum flank, but may be present on the posterior thighs, legs, back, and shoulders. So as well as I said, he has a Mongolian spot in her back. So the third assessment, which is the head. The head is based on the examination using the inspection and palpation, and we will assess for the size, shape, and symmetry. Assess the head for the scalp, the suture, the fontanelles, as well as the measures. First, we will assess the scalp. This is the scalp. The scalp is examined for the distribution, the amount, and the texture of the hair, as the hair is silky, as may be straight or curly, or kinky depending on the ethnic group, but we will see that his hair is straight and silky, as smooth as code. Right after the suture of the head. The newborn's head or baby's head is palpated for the suture, for the presence of all suture lines. So we have the suture lines feels like soft and the presence between the cranial folds. And in the baby's sutures, some babies will have a completely bald and some will have a ton of hair, but this is so much hair, and that's great. So when you're checking the suture lines on the baby, just take your hands and kind of like run it like this. So kind of see, do you want to see the corneal suture and the sagittal suture of the baby? Here is the corneal here, and the sagittal suture line is here. So right after the fontanelles. So fontanelles is here, and we have the anterior and posterior fontanelles. And this is the soft membrane was covering where two sutures met. So like this. So this one, this, okay? Fontanelles are measured diagonally from bone to bone rather than from suture to suture. They vary in size, and the anterior fontanelle is a diamond shape, anterior. And we have generally measured it to 1 to 4 centimeter. and closes around 18 months of age. The anterior arch should be soft, open in the presence slightly, and may be bulged with crying. So anterior pulsation may be felt over the anterior fontanelles. And the posterior fontanelles is triangular. It's triangular, okay? Generally measures less than a finger tip and closes between 2 and 4 months. So we have the fontanelles are the best palpated when newborn is quiet. And this newborn baby is not quiet. It's just talkative, and I like it. And that's okay, and that's good. And measurement, and the last is the measurement. We have to measure the newborn's head or the baby's head. So we will use again this, which is the tape measure. We will place just above the eyebrows and continues around to the occipital prominence at the back of the skull. And then this measurement, we already done this. We'll assess the eyes. In the eyes, we have the baby's eyes. We will assess the use of inspection. The eyes should be symmetric in size and as well as the shape. So yung lids may be damages and puppy. So the eyes will assess from the jaundice, the pupil condition, the tracking, and the spacing. The color of the eye structure are observed, and he has a color black eyes, and the eyes should appear clearly without any redness or purulent discharges. So as we can see, so there is no discharges of the eye. We should also observe for the subconjunctival hemorrhage. It is the result for ruptured capillaries during the birth process. So subconjunctival hemorrhages usually resolve within a week. So there is no subconjunctival hemorrhages in the eyes of the baby. The distance of the eyes measured from the inner canthus, this, and the measure is 1.5 to 2.5 centimeter. If the baby has an eye space closer, it is maybe hypotelorism, or further apart, it is hypertelorism. Maybe variation of or normal or associated with other anomalies. So that is our maybe if has the baby. So if the baby's eyes has a small palpebral fissures, may also be a normal or associated with other anomalies of the baby. But this baby is good, and that's great, and he has a pair in all. And we also have the blink reflexes. He has a good reflexes. The activity of the pupil are evaluated, and he has a darkened also. Maybe the equal color as well, and thus the clarity does this better. And of course, the movement of the eye is also observed, and then that's very good, and they are all normal. Assessment: the newborn or the baby's ear is assessed by the inspection and the palpation. So here's the ears. Okay, we will assess for the positioning, response to sound, patency, and as well as the cartilage of the ear. So the first one is the positioning. So the positioning of the ear is the pinna is normally lies on the above or on the imaginary line drawn from the inner to outer canthus of the eye. So the inner canthus and the outer canthus will be this. So it will be this. And then the result is normal. The ear is on the position. The second is the response to sound. The response should be evaluated and taken before 1 month of the age, and he has a good sounds or the better response to sound. And then we have the patency. Patency, the ear canal is inspected for patency. We will use an otoscope if we had, but we don't have. And that's limited because newborn ear canals contains if has if it has burnix and or the mucus and the cellular debris, but we haven't otoscoped yet. And then right after we have the cartilage. Cartilage here, the cartilage, it should be felt along with the edge. So this is the cartilage of the baby. So we have the normal ear. So he has a normal ear and the normal cartilage is odd shape. So right after we have the nose. So in the newborn's nose, we will assess for inspection. So the first one is the patency. Patency should be determined by either obstruction, which is one nair, and observing breathing through the opposite nairs. So like this. And this. And if we have the abnormal findings, which is the flaring nostrils, if the baby had flaring nostrils or nasal flaring, it is a widening of the nares. It is compensatory mechanism that decreases upper airways resistance, allowing more air to enter in nasal passages. So don't cry, baby, it's okay. So always remember that nasal flares occur when the nostrils widen while breathing. That is often signs of trouble breathing, and the nasal flaring may be indication breathing difficulty or even respiratory distress of the infant. But this infant, it's good. He has a good patency or good breathing. For the mouth assessment, we will observe for the cleft lip, left palate, and the tongue tie. We will assess for the appearance and feel of the palate, lip, and mouth color, as well as the tongue and lip cleft. Okay? So for the appearance and feels of palate, so we will use our index finger and put it on the baby's mouth to know if it's intact. So let's see. It's intact. It is soft. Maybe it's as hard, and now he uses the sucking reflex that you will be discovered if you put it. And then it is intact, okay. And then as we observe, there is no cleft lip in the baby's mouth, okay, as we will see. And then so we have the observation, which is the soft palate. That is the back of the roof, which is and it is the upper, and the hard palate is the bony part of the roof, closer to the teeth. Okay, and it's the main function of the soft palate are to aid the speech, swallowing, and the breathing. So we will assess also the tongue tie. Okay, baby. Oh, there is no tongue tie or the ankylosing of the baby. So as we see earlier. So right after we have the neck assessment. The neck of the newborn is short, as we see. Okay, it is an open chubby as it feels cute. This one. And the crease with the skin folds. Head should be rotate freely on it. So it is pretty rotational. So the first is to inspect the neck for abnormalities such as shortened length, if it has lumps, clavicular fractures here, if he has, but I think there is nothing, and that's great. So we have the first assessment, which is the enlarge the gland. Usually this gland as the lymph nodes is under this, which is in the location of the neck. So the lymph nodes sometimes called the lymph glands, and usually this is the type of lymphadenopathy. That means swelling of the lymph nodes or organs. So, and I think this baby has no that kind of enlargement of the gland. Okay, and right after on, we have to know if has the baby. So we will check if he had the enlarged gland here. So there is no enlargement of the gland, and that's great of the baby, and that's all normal. So right after we have the upper limb. So this is the upper limb of the baby. So we will check and inspect for the abnormalities, the asymmetry, the missing fingers, the single palmar crease. So as is this, he has a good and structure of the upper limbs, and then he has an asymmetry. The missing fingers he has already the 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. That is good, and it is all full and well organized, which is he has a perfect finger structure. We have now to palpate the compare, then brachial pulse, and edge upper limb. So the brachial pulse of the baby is here, and it's good. And then right after here, and it's good. Okay, and the upper limb is also symmetric, and it's normal, and that's great because it is an equally structure. So right after we have the chest. In chest, we will assess for the symmetry, discoloration, checking their arms positioning, sniffles, monitoring heart for irregularities, count heart rate, auscultate the lungs front and back. So first we have the symmetry. So symmetry, the chest movement should be symmetric, and I think we will see it. Okay, so that's symmetric. For the discoloration, there is no discoloration as we observe. Checking their arms positioning. So like what I'm said in the upper limb assessment, they are equally or symmetry. And then they are well flexed like this. Okay, and usually like this. And then the nipples. The nipples should be round and small. And then right after, we have to monitor the heart for irregularities and count heart rate. One of the important in assessing the chest is to monitor the heart rate of the baby. So this heart rate is under the vital signs, and we done that assessment. Right after, the auscultate the lungs front and back. So as we not be hardened as the situation, we will auscultate the lungs of the newborn or the baby side to side, because lots of sound can overpowering the lungs sound. So let's try this. And that's okay. So now we will assess for the abdomen. When examining the abdomen, it would be beneficial to use one hand to hold the legs with the hips and knees to flex and help to relax the baby. So we will assess the abdomen for enlarged organs, the masses, the hernias, bowel sounds. First, we will inspect the abdomen if it is distended and or not. So the abdomen of the baby is flat and it's not distended. Right after, the abdomen should also be auscultated. It is auscultated right and left. Near the umbilical cord. So right after, we will check for the skin around the umbilical cord here. And then we should look for clean and dry. So this it will be clean, yes, and it should be dry. Yes, it should be dry. And right after, we will be evaluate whether an umbilical hernia is present. If the umbilical hernia is present, it feels firm or stuck in place, may be incarcerated and should be evaluated by a surgical specialist. But this one, there is no hernia. Okay? And as we observe, we also have no signs for hernia, like bumps, mumps. And then next, we have to palpate the infant's abdomen by placing one hand on top of the other, which this, and then gently push on the right side of the abdomen. So like this, we will have to put it in the abdomen of the baby, and then it should be the right side, like this. Or else sometimes they are using one hand. And then right after, the liver edge should be either not be palpable or lie very close to the newborn's ribs, and then the liver is usually approximately 1 to 2 centimeters below the lower costal margin. Palpate around the abdomen is carefully assessing for masses if it's present. It may be painful or may be helpful to use the flat of the fingers like this. Flat the fingers here other than the tips. Usually the abnormalities in palpating the abdomen is the organomegaly. So if the baby has an organomegaly, it is an enlargement of the organ. But we have normal, and there is no abnormalities in the abdomen of the baby. They're all good and they are all normal. Right after, we have the anogenital area. In this anogenital area, we will move to this part of the baby. So first, we have to the anus. Of course, we have to remove his diaper. Okay. Ooh. So we will see the anus of the baby, and we have to inspect to be certain that is present, patent, and not covered by a membrane. You will see. It's good. It's normal. And then right after, we move to the genital area, which is the genital area of, this is the male genital area of the baby. So we will assess the appearance, testicle for descent or the herniation, the discharges. The penis is normal in size and no lesion that you've seen here. Okay? And then, of course, there is no diaphragm rash or the rashes. And then the scrotum is free from, and then it is very loosened or it is pendulous. Okay? So the testes are equal in size. It is smooth, mobile, and free from masses. And as for the discharges, there is no discharges occur. But that's normal if it has a redness or something here. And that is normal because sometimes it is red talaga. So now we will pack it again. Baby. Okay? Baby. We will inspect the lower limb for abnormalities like, for example, the asymmetric edema and ankle deformities, as well as the missing digits. So the lower limb is symmetric. Yeah, there is no edema as well as deformities. They're all well structured. And then above the numbers of foot fingers, 1, 2, 3, 4, 5. 1, 2, 3, 4, and 5 is perfectly complete, and there is no missing digits. As we assess for the movements of the both lower limb, the lower extremities, we're going to look at first of all just the passive position of the baby, and that is normal. And the baby is in a somewhat flexion. They are so aggressive. Well, look at the range of motion of the hips, like this. And I meant that the flexion of the knees, we're seeing for the resistance here, like this. That's good. And a little bit more rotation or the abduction. So a little bit like this, and or rotation if we are checking for this. And ooh,
Baby, it's so good. I like this. Yan.
And now we can extend and flex the knee, and it's pretty easy because he can flex like this and flex like this, reflecting a lower tone and the knee and symmetric. While looking at the ankle, we see the full range motion, and as what you see right now, that's a full range of motion, and that's all normal for the lower limb of the baby. Back assessment, we will inspect the back and supine for abnormalities such as scoliosis, hair tops, navy, sacral pits, and now we will assess for the curvature of the spine. So the spine of the baby typically appears flat. So if we see this, like this, okay, it is flat. They are all flat like this. And right after, the lumbar and sacral areas is already also flat. The base of the spine should be free or any pinpoints opening, dimpling, or sinus tract, and the skin. As we see and observe earlier, it is flat, right? Here, look. There are spots, as you can see, which is the body area. There is a Mongolian spot, and that's fine, because it's a totally birthmark of the baby. So cute. That's normal. It's normal. So the last assessment, which is the neonatal reflexes. It is also known as developmental primitive or primitive reflexes. We will assess a selection of the baby's reflexes, such as palmar grasp, the rooting reflex, sucking reflex. The first one is the sucking reflex. The implant mouth opens and I will put my index finger and the baby will suck it. So we should put it here. Oh, she already sucked it, right? And that's great reflexes because he sucked it. Oh, he also bite it, you know. Oh, shh, shh. Then right after we have the rooting reflex. The rooting reflex, it has a characterized as stroking the cheek or the corner of the infant's mouth. So the infant's head turns toward here like this, and Simus open his mouth. Look, right? His head is going to rotate. Here again. Baby. Oh, like that. So the last reflexes that I select is the palmar grasp. It is using by the index finger, placing to the palmar surface of the infant hands and the infant's hand grasped by index respectively. So let's try. Baby, so get. Come on. Oh. Right here, look. He grabs my hand, my index finger, and that is all assessment from head to toe. And now he's crying because he's so irritated, and it's okay because see, it's so late, and then he's not comfortable because but that's normal thing when it comes to baby. And that's all. That's a head to toe assessment.